very clear that if you characterize by gene or proteomics, that you do see a very broad epidermal differentiation problem in the skin, severe eczema. These are people who failed cyclosporin or
members of the CEHA, members of TCA, our international distinguished guests from all over, representatives from the European Academy of Allergy, Asthma and Immunology, representatives from the American College of Allergy, Asthma and Immunology, American College and American Academy, representation from Interasthma, Professor Walter Canonica, please. A representation from the World Allergy Organization, the President-elect Ignacio Ansategui. I'd like to just say that the simple statement was once said, and I repeat this from the time Chesmi and I inaugurated the Yakiwao meeting in Milan.
Our young health system, relatively young health system, always strives to adopt the best international standards in many disciplines. So I know myself, I'm a transplant nephrologist, so I can...
You know, we don't have many allergists in the world. We don't have many allergists in this region. We have very few allergists in this country. And this is why our field attracts pediatricians, family doctors, dermatologists, ENTs, pulmonologists.
أبو ظبي كما رأيتم مدينة عصرية جديدة تؤمن تماما بالعلم والمعرفة وبناء الإنسان بالإضافة إلى البناء الذي رأيتموه حولكم.
80% of success is just showing up, and that's what you've demonstrated by voting for the event, by coming over, especially the delegates who've taken this arduous journey, okay, to build academic bridges and make this happen with success.
I'm Professor Dr. Ruby Pavankar, the chair of the 3rd Middle East Asia Allergy Asthma Immunology Congress, and also the founder of the MIAC. I'm also the immediate past president of the World Allergy Organization, a global organization of 97 countries around the world. Allergy is a major problem worldwide. Many children and many adults with allergies are actually almost 30 to 40% of the global population. Asthma affects about 300 million people in the world, and rhinitis affects about 400 million, and about 250 million people suffer from food allergies, of which 5 to 8% actually are children. And food allergies can be very severe, resulting in severe allergic reactions like anaphylaxis, leading to shock and death. We have gathered here to actually have a scientific meeting with multiple different topics covering the field of allergy, asthma and clinical immunology, and covering almost 22 symposia, 5 plenary sessions and multiple workshops. This is targeted to people who are allergists, but also people who come from different subspecialties in order to help develop their expertise in the practice of allergy and to update their knowledge. Allergy is a growing problem worldwide, not only in the developed world but also in the developing world. More so, it is also one of the NCDs, which we as a global organization, the World Allergy Organization, have been engaging with the World Health Organization and the United Nations to consider allergy as a key area that should be included within the framework of the non-communicable diseases. Considering the issues that we deal with, there are regional differences, and these regional differences are important, and we're very, very happy that we're able to do this here in order to stimulate research, stimulate more evidence coming from the region that leads to better practice parameters within this region.
I'm Dr. Faris Zaitoun. I'm the co-chairman of the third meeting of the Allergy Asthma Immunology Congress. This is an international level meeting on the subject of allergic disease. Allergic disease involves just about every organ system in the body. It has become more prevalent in the world. This is why we are having this conference, to emphasize the importance of this condition. We've had two conferences such as this one before. This is the third installment of the Middle East Allergy Immunology Congress. We have a very exciting program covering all aspects of allergic disease, involving the upper airway, the lower airway, the skin, anaphylaxis, drug allergy, angioedema, and immunotherapy. We have over 50 speakers from all over the world in this meeting. We have 100 lectures to be given over 3 days. So a doctor who attends this meeting can see up to 3 lectures per hour if he or she wants to. We invite everyone, if they can still come, to attend the meeting, and if they have any questions about allergy immunology, they can call us or they can contact us, and we'll be happy to answer any questions that they have. Thank you.
Hey, hi, my name is Dr. Abdullah. I'm the head of the Department of ENT at Qasmi Hospital. I'm going to talk about the history of the development of the Middle East Asthma Immunology Congress. This came about after a meeting with the World Allergy Organization as an offshoot project to bring about knowledge and skills about management and progression and development and improvement of standard of care in terms of allergy, asthma, immunology. The founders were namely Prof. Ruby Pawankar, the ex-president of the World Allergy Organization, Dr. Faraz Zaytoun, Dr. Abdullah Ibrahim, myself, and this was initiated sometime in 2009. And we affiliated and we liaised with World Allergy Organizations. We drew up the scientific component, and we were supported by various societies across the world in terms of support, so that we could bring about academic changes and bring about knowledge and skill transfer by building bridges across various societies, and hopefully plant the seed that would develop into knowledge and skills, empowering our healthcare professionals to deliver a 5-star standard of care to our end users who happen to be patients.